I felt that my experience of having a tumor and recovering from it should have some value, and I wanted it to benefit other patients in the future. At the end of the day, I feel that there should be very little concern or anxiety from people who are going to be thinking about getting involved in research.
Well, there's so much we don't know about kidney cancer as well as other diseases, and so by learning more and by doing research, we can understand the disease better, and ultimately this will lead to better treatment options, better surgical techniques. So it's really exciting stuff that happens in the lab, because this is where the scientists use the patient samples, which are donated by our patients interested in research, and they use the samples to grow cells and experiment on those cells to see how the cancer cells function and what we can do to affect those cells and to stop them from growing and causing harm. Agreeing to donate your samples for the research, the kind of research projects that we do, has got no influence on your clinical pathway. You're not experimented on, you're not agreeing to any additional procedures or any additional visits. So we try to make it as easy as possible so it doesn't interrupt your daily life at all by participating in research. I'd like to reassure you that your personal and your personal details will all be confidential, and the samples that you donate cannot be linked back to you personally by the scientists that are working with the tissue.
I always explain patients who are willing to take part in clinical trials that they need to know that it's not compulsory to take part. It's free of their choice. But the benefit for a patient who takes part in a trial may not be immediately obvious. So they do that more for a motive of helping others. But they can be reassured that their treatment already benefited from others who took part in research before them.
One of my kidney cancer patients who had a very large kidney tumor invading the major blood vessels underwent surgery here under my care, and they were very grateful. And when I approached them, they wanted to do something positive towards the development and understanding of kidney cancer research. They decided that they will contribute to the development and establishment of the Kidney Cancer Research Lab. And she was known as Meena Raja, so we named the lab behind her as Meena Raja.
It's vitally important that patients get involved in research by donating their samples. There's only so much you can do with lab-grown cells in an artificial environment. The way that patients donate their samples and allow us to use their clinical details allows us to really marry up what happens in the lab to what happens in real life. If you're interested, then do please talk to the nurse or to the surgeon that you'd like to take part in research, and we'd be delighted to give you more information.